Video presentation, Splitting Schizo-Hairs, Carissa Eeds, Psychopathology, Coun5153, Dr. Jerry Ellis, Mid-American Christian University, February 25th, 2024. Let's discuss the key factors that define psychotic disorders. Key factors that determine psychotic disorders, according to the American Psychiatric Association 2022, are characterized by abnormalities in one or more of the following 5 domains: delusions, hallucinations, disorganized thinking, such as speech, grossly disorganized or abnormal motor behavior, including catatonia and negative symptoms. Next, we will look at the critical factors defined in each disorder. Mawad states that in schizophrenia, the characteristics that include delusions such as false beliefs, hallucinations by sensory perceptions without external stimuli, disorganized thoughts and speech, unusual behavior, and social withdrawal. The duration of these characteristics need to be persistent over at least 6 months, which impacts daily life. Schizoaffective disorder. Features combine schizophrenia symptoms with a mood disorder, for example, depression or bipolar disorder. Symptoms include of hallucinations, delusions, and distorted thinking, similar to schizophrenia. Schizophreniform disorder presents itself with schizophrenia-like symptoms lasting between 1 month and 6 months. It is rapid onset and the duration is shorter than classic schizophrenia. Next, examine the distinctions between schizophrenia, schizoaffective disorder, schizophreniform disorder from the standpoint of diagnosis. Examining the distinctions between schizophrenia, schizoaffective disorder, and schizophreniform disorder from the standpoint of a diagnosis, schizophrenia definition is a severe mental disorder characterized by hallucinations, delusions, and disordered thinking. Marks 2022 states that individuals must have 2 of the critical features persistent at the same time for a month to be considered schizophrenic. These symptoms cause severe problems in social work, academic, or family life. The duration that persists for at least 6 months, and psychosis alters the perception of reality. Additional signs in people with schizophrenia may exhibit slow or unusual movements, isolate themselves, or appear emotionless. Stages of symptoms can vary in severity over time. Schizophrenia is a type of psychosis affecting a person's perception of reality and logical communication. Treatment of this disorder is managed with medication and therapy. Next is schizoaffective disorder. The definition is that it combines features of schizophrenia and mood disorders. Symptoms include schizophrenia symptoms plus mood episodes of depression or mania. Additionally, schizoaffective individuals experience episodes of depression, mania, or both. The affective comes from the ABCs of psychology. It divides the mind into 3 different domains. A is for affect, B is for behavior, and C is for cognition, which is how individuals think. There is no specific duration requirement. Mood disorders primarily affect emotional expression, so they are called affective disorders. Schizoaffective disorder is a combination of alterations in emotions and thinking abilities. Schizoaffective disorder is one of the 6 types of schizophrenia. This disorder is complex to work with due to symptomology. Treatment for this disorder requires constant psychiatric care. The complexity is challenging to manage both psychotic and mood symptoms. Last is the schizophreniform disorder definition, which shares similarities with schizophrenia but has limited duration. Symptoms are like schizophrenia. It involves severe disruptions in thinking, feeling, and behavior. The duration of the symptoms lasts less than 6 months. Schizophreniform disorder can begin quite rapidly. The differentiating factor is that unlike schizophrenia, which often develops gradually over months or years, schizophreniform disorder has a shorter time frame. The last concept that will be covered is why it is essential to have specifiers and modifiers presenting and listing the diagnosis. Specifiers and modifiers are essential when listing a diagnosis because of precision and clarity, treatment planning, prognosis and outcome prediction, research and epidemiology, legal and disability considerations, and communication among professionals. Specifiers provide additional details that enhance the precision of diagnosis. They help differentiate between similar conditions, making it easier for clinicians to understand the specific features. Specifiers guide treatment decisions. Different subtypes may respond differently to medications and psychotherapy. Specifiers influence the course of illness and prognosis. They provide insights into anticipated disorder progression and outcomes. For instance, considering specifiers help predict the outcome of schizophrenia with catatonia. Specifiers allow researchers to study specific subgroups. Accurate coding ensures relevant data for prevalence studies and treatment efficiency research. Specifiers impact legal matters and disability claims. Proper documentation provides eligibility for service, accommodations, and funding. To sum up, specifiers facilitate communication between mental health professionals. When discussing cases, clinicians can quickly grasp the nuances. Remembering, including specifiers and modifiers ensure accurate diagnosis, better treatment planning, and improved communication in the field of mental health. Thank you for your time.